Welcome to the Joint Subcommittee on Human Services. I'm Assemblywoman Michelle Gorlow, and I'll be chairing today's meeting. Madam Secretary, please call the roll.
Senator Canizaro. Senator Don Darrell Loop.
Here.
Senator Wynn.
Here.
Senator Severs Gansert. Senator Titus.
Here.
Assemblywoman Anderson.
Present.
Assemblywoman Dickman.
Here.
Assemblyman Hafen. Assemblywoman Howdigi.
Here.
Assemblywoman Monroe Moreno.
Here.
Assemblyman Watts.
Here.
Assemblyman Yeager.
Here.
Chair Gorlow.
And I am here. Thank you very much.
Thank you.
Friendly reminder, everyone, please make sure that your cell phones are on mute or off. In fact, I will check mine also. Public comment will be available at the end of the meeting. Everyone in public comment will have 2 minutes, and it'll be after the budget presentations. And now we will open our budget hearings for the Department of Health and Human Services Director's Office. There are 4 budgets on the agenda today. Director Whitley, please go ahead when you're ready.
Madam Chair and members of the committee, my name is Richard Whitley, and I serve as the Director for the Department of Health and Human Services. And whatever your preference is for me, I'm prepared to briefly go through each budget and pause for questions, if that is all right.
Yes, let's do each budget separately, and then we'll ask the questions.
All right, great.
All right, thanks.
Again, Richard Whitley for the record. So we have a PowerPoint, starting though on, I would just jump in then turning to page 7. This is budget account 3060, Fund for Resilient Nevada. On page 8, this decision unit, E227 funds a new biostatistician position to support the management and oversight of statewide programs regarding the opioid epidemic. Turning to page 8. This decision unit, E350, is a funding to be distributed to various entities to address the impact of the opioid use and abuse disorder. And decision unit E900 transfers 1 management analyst position from the Fund for Resilient Nevada to the Director's Office Administration to ensure appropriate cost allocation. That concludes the major decision units in this budget account, and we'd be happy to answer any questions.
Thank you very much. Questions from the committee? Assemblywoman Howdigi.
Thank you so much, Chair. And I did have a question regarding the evaluation and selection process. Could you walk us through how you select from the proposals that you received, Director Whitley?
Good morning, Madam Chair. For the record, Marla McDade Williams, Deputy Director Programs, Department of Health and Human Services. So we are just beginning the process. So there will be some internal transfers to ensure that we are meeting gaps within DHHS agencies and that we're not duplicating. Outside of that, there will be a competitive application process and review that's set up. We anticipate that to start probably midsummer for those that we have identified a need to actually issue a grant process for. But similar to how we run grants management, we issue the notice of funding award. We ensure that there is a group to review and match up against the goals and objectives that have been outlined in the state plan and the needs assessment.
Any other questions from the committee? Oh, Assemblywoman Dickman?
Sorry. Thank you for including unallocated authority from the Fund for Resilient Nevada, and how does the agency anticipate using the unallocated authority?
Stacy Johnson, Deputy Director for Fiscal Services, for the record. I'm not sure I understand the question, other than the fact that when you say the unobligated authority, we have a formula that we developed to spend these funds, and so that the funding will last over the course of the program, which we're anticipating to be about 16 years remaining. So we take the total projected, which we don't really know what those settlements are going to be at this point, but the total projected, and divided it by the number of years remaining, and it tells us about how much money we can allocate each year. So that's would be why there's amount in the reserve, so that we can continue to fund the program through the remainder of the term of the program.
Okay, thank you.
Next, we have Senator Dondero Loop.
Thank you very much, Madam Chair. The recommended spending plan, does it include any funding for activities related to the Implement Recovery Communities Access and prevention?
For the record, Marla McDade Williams. So in the 7 goals that have been outlined, which are to ensure local programs have the capacity to implement recommendations effectively and sustainably, prevent the misuse of opioids, reduce harm related to opioid use, provide behavioral health treatment, implement recovery communities across Nevada, provide opioid prevention and treatment consistently across the criminal justice and public safety systems, and then provide high quality and robust data and accessible, timely reporting. So as entities have the opportunity to make proposals that are consistent with those goals, then there's an opportunity for them to be provided funding. The needs assessment is very extensive and identifies a lot of gaps in the system. So it really is a matter of identifying and prioritizing those gaps and filling them.
So follow up, Madam Chair. So has this got far enough, I guess, where you have interacted with the law enforcement divisions of whatever city you may be in doing this in?
For the record, Richard Whitley, Director. Through you, Madam Chair, to the Senator. We're working with law enforcement, and we're building off the relationships we already have with enrollment, if they have a chronic health condition, enrollment, and more of a warm handoff to the community from both jails and the Department of Corrections. But we're working on that. We don't have a detailed plan in place, but clearly a need. It's an opportunity to intervene and perhaps prevent incarceration.
That's sort of where I was going, so thank you very much for that. Thank you, Madam Chair.
Assemblyman Watts.
Thank you, Madam Chair. So connecting to a couple of questions my colleagues asked, so you spoke a little bit about the process that's going to be used to evaluate proposals moving forward and hopefully make sure we've got coverage across all of these different goals. And I noticed that, the Interim Finance Committee has approved some of these distributions to get some of this program up and running. And this budget proposal includes some new items. So can you just discuss, how those were chosen and added in, for consideration in this budget? The new items that are not extensions of funding for items that were approved by the IFC previously.
For the record, Richard Whitley, Madam Chair, through you to the Assemblyman. So the new positions, a biostatistician, one of the priorities, as Deputy Director McDade Williams mentioned, was data. I mean, and this isn't data to analysis to further identify the problem. It's data analysis to know really where the gaps are in service and these dollars need to be prioritized. So I think it's an important distinction with that. And then the management analyst as a position is actually cost allocated. So one of the things that I think is important with this is we took an approach to not duplicate, you get a categorical funding, you establish all the administrative structures to oversee it. We're trying to utilize existing structures and get the funding to the agencies in our own department that put funding out so that we aren't using direct service dollars administratively. And so cost allocation is the way we do that. And so that is the other thing in this budget is to actually incorporate the cost allocation for the overall management.
Thank you for that. Could you just provide a little bit more detail? So, for example, I think, there are programs with UNR Center for the Application of Substance Abuse Technologies that I think are new initiatives under the Fund for Resilient Nevada. So could you just speak a little bit to the inclusion of some of these new activities?
For the record, Richard Whitley, Madam Chair, through you to the Assemblyman. The UNR's Center for, I forgot what the S meant, Applied Technologies, they're a nationally recognized technical assistance and support agency for substance abuse, and we utilize them with our other grant funding. So here perhaps is an example where rather than funding through one of our divisions, public and behavioral health, to then turn around and fund, we would fund direct. But to keep with that model of standardization of, it really is to help providers with training and to have the latest standards of care, which we would fund to.
Okay, next we have Speaker Yeager.
Yeah, I do. Thank you, Madam Chair. Director Whitley, good to see you again. I just had a follow-up question to, I think, one we asked, maybe it was last week or the week before in the the pre-session budget hearings. And relating to this account, I think I'd asked the question about whether any of these funds can be used to help family members of those who passed away because of opioid use. And I think there was maybe we weren't sure about that answer, so I just wanted to follow up to see if you had any more definitive statement on whether these funds have to be used, directly for people who are currently experiencing opioid issues, or if it can be used for family members.
For the record, Marla McDade Williams, to you, Madam Chair, to Speaker Yeager. So under the Goal 5 of implementing recovery communities across Nevada, I believe that would fit as an appropriate activity under there as proposals come forward.
Thank you. Next we have Senator Severs-Gansert.
Thank you, Madam Chair. I went to the wrong room, so apologize for my tardiness. I had 2135 on here, but then I walked in and there were no seats. So I quickly figured out that was the wrong place. Okay, so I don't know if you've talked about this or not. So I'm part of the Surge Committee under the AG's office to make recommendations for the state plan. And I was just looking at, like the dollars. We expect the net allocation of about $122 million. A lot of it's over time, but there's some money, maybe $50 million that's going to be coming in probably, or came in last year. So when do you anticipate taking those recommendations and actually formulating the state plan for how you think we should spend those dollars?
For the record, Marla McDade Williams, Madam Chair, to you through Senator Gansert. We will have to come back with work programs to actually accept any new funding, right? That isn't budgeted already. So as we go through the list and the state plan and the needs assessment, after we've allocated a certain amount of money, then we would come back for a work program to allocate more. Again, looking at how do you sustain the account over time
Right.
and not spend it all immediately. But, the overall goal is to really build a system within the state of Nevada across all spectrums. And so the more money we have, the better ability we have to do that.
Thank you. And again, this is the opioid settlement. I don't know if I started out with that, but it's about $122 million that we'll get through July of 2038. And so I appreciate that you need to build a resilient system, right? Something that's going to help as many people as possible and sustainable. But at some point in time, it seems like you're going to have your master plan done. And my question was around sort of the master plan for the state as far as priorities and types of buckets of money where where you want to put things or funding.
For the record, Marla McDade Williams, we are required to redo the state plan every 5 years, I believe. So we have a state plan in place now that is available on our website, and it identifies priorities. And then in the next 5 years, we will conduct another state plan to assess the system, see how we did, and then what the rest of the needs are moving forward.
Thank you. And just to follow up, that's the state plan strictly limited to the opioid settlement. That's what I'm
Correct.
talking about. Okay.
Correct.
Got it. Thank you.
Any further questions? Okay, seeing none, before we move on, I do want to apologize to the members. Apparently, there's been some miscommunication on what room we were going to be in. So we'll make sure next time that everyone has the same room. All right, we'll go ahead and go on to the next budget. Thank you.
Thank you. For the record, Richard Whitley, Director of the Department of Health and Human Services. And turning to page 9, budget account 3150 is the Department of Health and Human Services Director's Office Administration account. On page 10 are the major changes in this account. Decision Unit E226, this would allow us to fund contract support that would supplement our agency in addressing gaps in fiscal management. I've talked about in other committees, probably to a fault, focused on direct services, but if you think about it, our delays in funding community probably has greater impact on populations and is equally important. And we have a shortage of and a retiring fiscal staff, and so this is a new item in our budget, not intended to supplant a state position, but really to subsidize and to keep things going, training primarily. Turning to page 11, Decision Unit E229 funds 2 contract positions to support the Office of Minority Health and Equity. Decision Unit E900 transfers 1 management analyst position from the Fund for Resilient Nevada to the Director's Office Administration to cost allocated appropriately. And that concludes the major changes in this budget account, and we're happy to answer questions.
Thank you very much. Do we have any questions? Okay, Assemblywoman Anderson?
Thank you. Thank you, Chair, and thank you for the presentation. So for both of these positions, apart from the pandemic research responses, what other health-related programs would these 2 additional contract staff be working with? And then also, how is it determined to be 2 positions as opposed to 1 or 3? Why was it decided upon for 2 staff members?
Stacy Johnson, Deputy Director for Fiscal Services. Madam Chair, through you to Assemblywoman Anderson. So there wasn't really a lot of thought put into it. The thought on these positions was hopefully finding some retired employees who would be willing to come back, who had some state knowledge, probably wouldn't be willing to work full-time, maybe part-time, but we have had a lot of needs. So, we've had on average, a 60% turnover in our high-level fiscal staff across the department, and some of our divisions have actually had 75%. One of them will have 100% possibly turnover in our upper-level fiscal staff. So we just don't have the knowledge there, so what we were looking for were people who had the knowledge who could come in, probably only willing to work part-time, but then could build our staff back up. So it wouldn't be permanent, wouldn't be ongoing, just for a matter of time till we could get our fiscal staff retrained. If we found a person who wanted to work full-time, that would also work. So it doesn't have to be 2 part-time people. That was just how we were figuring when we were building the budget, that it would be easier to find possibly 2 part-time people.
Just to make sure I'm understanding correctly and to clarify, it's mostly for in the fiscal area, not necessarily for specific programs is what I'm hearing. Is that correct?
Stacy Johnson, Deputy Director, I believe that is where we will use those. Not that they won't support the programs, because they do, but I think we need the fiscal staff to be able to help get the money out to the programs would be the goal.
Next, we have Senator Titus.
Thank you, Madam Chair. And thank you for at least recognizing that you need more staff in that department. There's not a medical journal that I receive that doesn't address the disparity in health care to our minorities and the poor health care outcomes that they have. It's real, and I worry about rural health, but there's areas in urban areas and our, whether it's our reservations or whether it's out in some isolated community in rural Nevada, there's some real disparities in healthcare access. And so I like the department, but I'm just wondering if it's enough. And if these folks, what I'm hearing, are really going to be about how, helping monitor where the money is spent. I'm wondering about outcome data. Will they be able to know if are we making a difference? Does this office add hope? Or are we actually chipping away at some of these disparities? And that's what I'd like to see if you have somebody collecting data, and not just making sure the money gets out, but is the money being well spent, and are we making a difference at all? Because it's a huge void I see in our state, and not just in our state, but nationwide. But especially if we have this department, we could use it to really, I think, make some difference and at least give us where the holes are. You mentioned, Director Whitley, earlier, we really would need to know at the opioid settlements, where are we missing things, right? We have a lot of agencies, a lot of departments, a lot of programs, but are we making a difference? And so is anybody doing that?
Madam Chair, through you to Senator Titus. First, I think I need to clarify. We have 2 decision units here for contract staff, and both of them are 2. So what Deputy Director Johnson was talking about was the fiscal support across the department, and then the Office of Minority Health also has contract staff as a decision unit. So and maybe I'm just doing this for me, to clarify that there are 2 pathways there for requests for contract staff. As it relates to the Office of Minority Health, I do think you're spot on. I mean, the need to not only identify a problem and dig deeper to see, in some health indicators, Nevada does fine. But if you dig deeper into the data, you find that some populations are at higher risk or have a higher burden of disease. And then, the added benefit we had from the support last session to integrate our Office of Biostatistics is to then look to see where are folks getting health care, and are they getting it, and what are the outcomes of that. So that is the intention. We just have different programs, I think, at different levels of maturity in terms of, and this is a very small program. Tina is a single person who's a system person, but yes, the intent is to utilize data, because the funding or resources to address the problems of disparity are in various programs. So hubbing that narrative of where the priorities are becomes very important.
Great, thank you. That's what I was hoping these positions would help do, is recognize, trying to put it all together and then come back and let us know how can we do better, where are we missing, where are we lacking. So thank you for that. Thank you, Madam Chair.
Thank you. Next, we have Assemblywoman Monroe Moreno.
Thank you, Madam Chair. And along those lines, for E229, for those 2 contracted staff positions in the Minority Health and Equity, I know that they're currently funded through grants that are running out. Could you tell us some of the work that they've done and how that's benefited, and what you expect if we fund these, continue funding these past the life of the grant, what are you hoping that they'll improve upon? What are you expecting these two positions to do?
I should, for the record, Richard Whitley, through the chair to Assemblywoman Monroe Marino. I should have had the director of that program here because it truly is a one-person operation and probably operated the best in the lifetime of the program, in so much as knowing the role that not filling gaps, but actually helping to be a connector. And so, as you can imagine, having one person do all of that, there's a need for public information, provider information, and engagement. And that really is the superpower of the director of this program. And the support that we're asking for is reasonable to focus in those areas and to assist. And we continue to look for grant opportunities to enhance this. Some grants have funding that's categorical that could address it, but not enough to really make a move. So we are constantly looking to see how to pull that together so we could be supportive, but it really is a coordinating effort. So those activities would be in that space of coordination and utilizing the forums that have been developed.
Well, thank you for saying that. I just want to mention that one employee, Tina, is absolutely amazing. I don't know how she makes it to every event throughout the city and throughout the state when people call for need. I believe these two positions are definitely a necessity. I'd like to see them as a regular FTE and not a contract position. I probably shouldn't say that on the record, but that one person doing the work of sometimes 5 is impressive. So you have an amazing employee. You should know that. And she is doing the work, and we need to get her more help. Thank you, Madam Chair.
Thank you. Any other questions? Okay, seeing none, we'll move on to the next budget.
For the record, Richard Whitley, Director of the Department of Health and Human Services. Budget account 3195 is titled the Grants Management Unit, and it administers, monitors, and audits 3 funding streams: the Title 20 Social Services Block Grant, the Community Services Block Grant, and the Fund for Healthy Nevada, which is the tobacco settlement dollars, which in contrast to the opioid settlement are in perpetuity. There's no major changes in this account. However, there are significant changes in the Healthy Nevada funding allocation, and we've provided a couple slides. If you turn to page 14, the chart shows a breakdown of the Healthy Nevada funds. The Healthy Nevada funds revenue have remained pretty steady over the past decade, and that's approximately $24 million a year. The next slide on page 15 shows how the Grants Management Advisory Committee has prioritized the allocation of the tobacco funding. The chart on 15 shows that where the changes are, to just highlight them for you. This Senior RX and Senior Independent Living, the Office of Minority Health and Equity, the public health districts, and administrative funds are where the changes are in the allocation of these dollars. And that would conclude my presentation on this budget account, and we're happy to answer questions.
Thank you very much. I have a question from Senator Dondero Loop.
Thank you very much, Madam Chair. Can you tell me about the process that's going to be utilized to determine which programs are recommended to be increased, reduced, or eliminated from the tobacco settlement funds spending plan? Thank you.
For the record, Richard Whitley, through you, Madam Chair, to the Senator. So the prioritization, there are multiple factors there. Some are like with Medicare, changes in Medicare where the need for those funds have changed. Others are emerging needs or data that shows there is an emerging need. Some categories, one was the wellness category, which is very broad, is the decision was made to prioritize public health, which is wellness and prevention, and to help support and stand up more local authority in that area. I think that I think we mentioned in our overview about several rural counties coming together with Churchill leading the effort to develop their own actual health district, which gives them opportunity to bring in direct funding and have local control. And so we really see that the investment this time in a focused way for wellness is a priority. So not a single reason for the change in dollar amounts for prioritization, but I sort of hit the highlights, but happy to provide more detail if you'd like.
Is this a fluid change then, or once the decision is made, does it kind of stick?
For the record, Richard.
Those probably aren't like the right words.
No, but I like them. The advisory committee makes their recommendations to my office. I've not, for the record, Richard Whitley, through the chair to the senator, I have not changed them, but there is in authority some flexibility there, which is good if something emerges. The burden's on me and the staff to present something that's emerging to the advisory group and to have the discussion. But I think that little bit of flexibility is good, but the categories are pretty established, and we come before you each session for approval.
Okay, great. We have fluid and stick. Okay, thank you very much.
Next, we have Senator Nguyen.
Thank you, Chair. I kind of have a follow-up question to like how the programs and how that determination is. And it's kind of following up on something that our chair had brought up during an earlier budget presentation about this secession programming. I know it's recommended that we spend about $30 million. Obviously, we're not anywhere close to that. So I'm curious to know what kind of investments and what kind of prioritizing have we made for those type of programming with this funding?
For the record, Richard Whitley, Director of Health and Human Services. Through you, Madam Chair, to Senator Nguyen. Maybe I need to define the term like cessation, because cessation, and when I spoke of this in our high-level overview, is a service, and I think I mentioned that one of the things we're trying not to do is use flexible dollars or grant dollars that even have a wider margin to subsidize Medicaid or subsidize commercial insurance. In the Affordable Care Act, cessation is a service that is mandated, and if you go on the American Lung Association's website, they actually have, like, the best that I've seen, a breakout of the requirements from Medicare, Medicaid, commercial insurance, even the exchange products. And there's some nuances with some populations, like pregnant women, that have expanded services in cessation. So with that being said, I think it's important to detail out what we mean by cessation. What isn't covered, though, which happens a lot in healthcare, is information how to navigate the system or what is available to you. And so if that's included in the definition of cessation is helping consumers to navigate and to use the coverage that they have, then that probably is where there are gaps, but you're right, that same ranking of states did, set the bar really high in the broad category of cessation. But when I look at that, I think it is defining it broader, and perhaps I misspoke in our high-level overview because I spoke specifically to the service of tobacco cessation, which is not, it's not prevention, it's intervention, what is covered is the service itself, to intervene and to assist with pharmaceuticals and counseling to help people to stop smoking. I don't know if that's helpful or.
No, that was incredibly helpful. So it's fair to say that there are other resources that we're able to utilize that aren't as restrictive.
For the record, Richard Whitley, if that was a question, then yes.
Thank you, and thank you for asking that. Those were some of the questions I had as well. Next, we have Assemblywoman Howdeggy.
I do have a question, Madam Chair. Thank you. I was just asking my colleague another question. Thank you, Director Whitley. I actually have a question regarding the grants management unit. So I noticed that there is a new program included in the spending plan for public health districts. Can you talk to me about, well, give us an overview about the funding recommended for public health districts and how it's going to be used?
Thank you, Madam Chair. For the record, Marla McDade Williams, to you, and through you to Assemblywoman Howdeggy. So, as you know, we have a new health district in the state, and part of this funding is really to help incentivize the health districts and help them to prioritize their needs for sustainable programming out into the future. So it is new funding designed to stand up and ensure that we can continue to prevent disease and keep people and communities healthy, and allowing them to strategically improve their infrastructure as they need it.
Thank you, Chair, for the follow-up. And I think, just for my knowledge, this is the first time I've actually sat on the HHS subcommittee. Can you explain to me what a health district is?
For the record, Richard Whitley, Director for the Department of Health and Human Services. It's driven by statute in our state, and so you can see the framework in statute on what jurisdictions, counties, and cities need to be in agreement to work together to become a district. Nevada is one of the few states where historically only our two urban areas, Clark and Washoe, had health districts, and the state, my department, was responsible for the implementation in rural and frontier Nevada, which you can imagine from Carson City doesn't always work so well with us having our finger on the pulse of what needs are. The health districts are the public health arm in the overall healthcare system. So they oversee really the protection of the public. They're the ones that, if there is a disease outbreak, are the first to respond. I mean, probably highlighted best during the pandemic, but I would be doing a disservice if that was all the example I gave. Any infectious disease, airborne, where like kids in a school or in a workplace, the local health districts respond to that and probably do it without many people even knowing what it is they're doing. They also oversee many of the preventive health services, family planning, STD clinics, HIV. HIV is probably as a robust program that has all the elements of a public health program, from primary prevention to surveillance, to understand like how the epidemic is changing, to care and treatment, is probably the best fully funded through line, largely funded out of federal funds. But the health districts implement that, and they implement it at the community level. And one thing that I think that we saw, and that the rural counties, many of them saw as well, was that local control is best in a crisis. And since the statute allows us to support a health district to develop, we want to encourage that. Also, Clark and Washoe could reach out to counties neighboring them and grow in that direction. And so we want to be supportive of that. Some of the Carson City relies on a lot of things that happen in Reno. So we want to be supportive but not restrictive. part of the problem in public health, as in all of health and human services, is the reliance on federal funding comes with categorical spending. So it may appear that we have a topical program, and then people get frustrated that we narrowly only do certain aspects of that program. The health districts are hamstringed by that same approach. They rely largely on federal grants, many that are passed through from us, and they don't have much margin to actually grow and develop. And so this is our attempt to introduce that support in a more targeted way than just general wellness. I probably gave you more than what you asked for.
Thank you. Real quick, I believe we have a comment from Senator Titus.
Great. Thank you, Madam Chair, and thank you for the explanation from Health District. And just to go a little bit further on that, there are only two recognized health districts in statute are Washoe and Clark, and Carson City has stood up their health district, and we in the rural areas have kind of been on their shirt tail as using Carson, and we call ourselves a quad county, but we're not an official health district. And so later on a policy thing, we'll see a bill enabling new health districts for the rural, some of the rural and frontier counties to go together. But thank you for that information, and health districts are critical that we align and kind of, it's actually so we can share some services, share some oversight, share the ability to respond quickly and not have to respond or depend on the state services when an emergency happens. And I won't begin to tell you the number of infectious diseases that were reported to me. That's an offline conversation. So thank you, Director Whitley.
Thank you. Next, we have Assemblywoman Monroe Moreno.
Thank you, Madam Chair. And staying on that same subject, with the money that's on the screen for public health districts, how will that money be allocated between Clark, Washoe, and the Quad County health districts that's not officially a health district, but how will you determine how that money is allocated? Or will it be on a needs base, they come to you for that money?
For the record, Richard Whitley, Director of Health and Human Services. Through you, Madam Chair, to Assemblywoman Monroe Moreno. Great questions for detailing out. I want to stay with the spirit of like trying to be helpful in this way, and it isn't defined. I had a meeting. I mean, this was my idea, so I had Marla respond initially, but I had a meeting with the health districts, and really this small amount of funding wasn't too appealing to Southern Nevada Health District at the time, just because it isn't a lot of funding. And so I do want to keep engaging them on the how of it, but I just want to punctuate that the key to this is the flexibility to stand up or expand. And we've talked about models like, in public health preparedness, which you'll hear in the Division of Public and Behavioral Health, we have agreements with the health district that when we get federal funding in for preparedness, which largely goes to public health, to the health districts, we have a funding formula and then a population overlay. This money isn't probably big enough to really have the population overlay to be beneficial. So having some sort of standard cost with standard distribution with, but I want to also incentivize, like Carson City, the Quad Counties have been lingering in a delegated authority from the state. So really, they aren't a health district, as Senator Titus said. We delegate to them to do that. I believe they need to take the next step. So I don't want to incentivize staying the same when they could move to the next level and actually be even eligible for additional funding directly. So I want to get it right and be supportive, but my ask in this is the flexibility to be able to invest in public health.
Thank you so much. Thank you, Madam Chair.
Thank you. Next, we have Assemblywoman Anderson.
Thank you, Chair. My question has more to do with the senior pharmaceutical information that's on page 15. There is a large change, and when I look over some other information, some background, it sounds like it's coming from grants and other organizations that provide supportive services. this is my first time on the committee, so might have already been discussed in other areas. But are those grants already assured? Because we all know that grants ebb and flow, and sometimes they're in, sometimes they're out. And then also, are these other supportive assisted living structures or other areas that are helping with this, are they assured that they will be there? Or is this a hope and prayer that they're going to be here 2 years from now for the 2024 and 25th biennium?
For the record, Richard Whitley, through you, Madam Chair, to Assemblywoman Anderson. So on the senior RX, I think Medicare is a large driver in that and change in policy. Less other grants. We have actually consolidated our efforts to help consumers, elderly consumers navigate and get access to pharmaceuticals. So, one of the challenges in presenting budgets where my agency might be giving funding to another program, you're going to get a detailed presentation in Aging and Disability on how this funding stream contributes to an overall program. I run the risk of talking too much and telling their story, but you really will get more detail. I don't think there's any better way to do this when funding comes from one agency to another and the program discussion, but I'm happy to pull out that program and provide you the information. But you'll get a detailed overview of that in this committee from Aging and Disability, how this one spoke adds to some others to make, an entire hub of support. And on the question, so the increase of funding for independent living, yes, we license those facilities, and, the whole goal of that is to keep people living as independently as possible in the community. And there are providers, same challenges that everyone else has with staffing and everything else, but this won't tie up funding that won't be utilized.
Okay, thank you very much. Any other questions? Okay, seeing none, we will move on.
For the record, Richard Whitley, Director of Health and Human Services. The final budget is budget account 3203, and that's our Office of Data Analytics. On page 17, the major changes in this account include Decision Unit E226, which funds a new biostatistician to support Nevada 988, and then Decision Unit E229, which is a new biostatistician that I talked about with the opioid program to support that statewide work with opioid settlement funds. And that concludes the major changes in this budget account, and I'm happy to answer questions.
Great. Thank you very much. Looks like we have a question from Assemblyman Watts.
Thank you, Madam Chair. So we'll start with the biostatistician for the 988 program, and I'm really excited about all the progress that we've made in getting this stood up. Could you just talk about the benefits to the program of this biostatistician position, and are the duties that would be performed by that position related to the statutory framework setting up the 988 program? Is it required?
For the record, Richard Whitley, Madam Chair, through you to Assemblyman Watts. Yes, we're compliant, first of all. Secondly, I think it's the same theme that I talked about previously with the data analytics. Why I think we use 988 as a euphemism for crisis services, and there is a whole continuum and where we intervene as a result. And that story needs to be told so we can keep moving upstream to prevent a crisis. So, the easy thing to say is we're trying to prevent people with crisis going to the emergency room. But those are all impacted by intervention points. And so it's essential, again, for data, not to further define the problem, but further define the opportunity for intervention.
Thank you. And so just to put a finer point on that, make sure that I have the right understanding. So there is definitely a data analysis role, but I think one of the things that is mentioned is it's also helping connect and share data with other entities that are engaged. So I think what you're saying is one of the big outputs isn't just crunching numbers or running reports, but helping build those connections to help get people support that they need. Is that correct?
For the record, Richard Whitley, Madam Chair, through you to Assemblyman Watts. Yes, that is correct. I mean, just like when we mentioned about Office of Minority Health and the leadership of Tina, Kyra Morgan is the state biostatistician, and one of the transformational things that occurred last session was your allowance of me to put all the statistics in one office under my office to serve not only our agency but the state, and that means the communities. And really, if you haven't look at the data dashboards on our website and just how they inform us on where we need to go next. I mean, I've heard from this body in previous presentations about just like we know where we rank low. So we don't need to invest in more people to tell us that, and that's the nuance with this. And it is key in what you said is that engagement to community. So having data and doing analysis, but how to, just like I'm trying to do with you all, how do I frame the narrative for elected officials to understand what we're trying to do? Because it'll ring hollow if we do it, but we can't convey it. And so I am confident that, and have experienced firsthand the Office of Analytics engaging at all levels with providers and community.
Thank you. Next, we have Senator Titus.
Thank you, Madam Chair, for the question, and thank you again for that information, Director. I need to understand where the money actually, what bucket that money is already in. So you say you're going to transfer money from the Division of Public and Behavioral Health Crisis Response budget to fund this new position. When we supported, or when it passed the 988 budget to charge a fee for every phone line to pay for the 988 crisis call line, it didn't include enough money to put this position, pay for this position. Is that clear? Is that what this is about?
Stacy Johnson, Deputy Director for Fiscal Services, for the record. Madam Chair, through you to Senator Titus. Those will be the funds that pay for this position. It'll be a transfer of those surcharge on the
Okay.
mobile providers.
So these aren't new general fund dollars. This is money that we have already established for 988 cost, and we're using some of that money for this position, correct?
Stacy Johnson, for the record. Yes, that's correct.
Thank you.
Thank you very much. And next, we'll go to Senator Nguyen.
Thank you. And I'm kind of shifting to some other programs. Can you provide like an overview of the expected benefits to the statewide opioid epidemic response efforts should that position be approved? And is approval of that position required to meet any of those statutory requirements or goals that we established in that Fund for Resilient Nevada state plan? So kind of two questions.
For the record, Richard Whitley, Madam Chair, through you to Senator Nguyen. Yes, it was a priority of the advisory group, the data part. Really, I don't want to come across like I just did with Assemblyman Watts, giving him more than he asked for. But it is as I talked about, using the data to know where we invest the dollars. It's critical to this program. Most of our, if you look at the budget in this account, most of them are funded out of category. Most of the biostatistics is funded out of categorical grants that may or may not have a big data component to them. And so, as much like we do fiscal notes, we need to do data notes. Like, what is the data requirement and what does it look like? And our agency is doing that when we get a new program. But unfortunately, the importance of the data was conveyed to the advisory group, and they did identify it as a priority to be funded. If that answers
It does, thank you.
Thank you. Next, we have Assemblywoman Monroe Morena.
Thank you, Madam Chair. And I kind of want to go back to the question that Senator Titus had asked about the E226. It was the 988. When I look at the information that we have and looking at the budget, there doesn't seem to be a companion decision unit in the DPBH budget. So how do we get to, like, the pitcher? We have the catcher. How do we get to the pitcher part? And will there be a budget amendment coming to address the difference?
Stacy Johnson, Deputy Director for Fiscal Services, for the record, Madam Chair, through you to Assemblywoman Monroe Morena. So that's an error in the budget. So there should have been a companion, and somewhere it got lost in transition. So the answer is yes, there will be a budget amendment that comes over to correct that.
Thank you so much. Because as I looked at it, I'm like, it's not penciling out correctly. So thank you for that. Thank you, Madam Chair.
Thank you. Any other questions? Any further questions? Okay, seeing none, we will now close the budget hearings. Thank you very much for coming and spending your morning with us. Next on the agenda is public comment. Because of time considerations, persons offering public comment will be limited to not more than 2 minutes. Please state your name and spell it for the record, and provide public comment by telephone. You can dial 669-900-6833. When prompted to provide the meeting ID, enter 813-686-47202, then press the pound sign. Again, the number is 669-900-6833, and meeting ID is 813-686-47202. We will start in Carson City. Welcome, and please push the button when you're ready.
Good morning. I'm Nancy Bowen, the CEO for the Nevada Primary Care Association. Good morning, Chair Garlow and members of the subcommittee. The Nevada Primary Care Association represents the state's 8 community health centers, also known as federally qualified health centers, or FQHCs. Our members provide integrated primary, behavioral, and dental health care to nearly 112,000 Nevadans in more than 60 clinics and mobile units statewide. To sustain this important work, we support the Health Center Incubator Project in Budget 3195. Health FQHCs were created to serve underserved populations and geographies, and in 2021, 91% of the Nevada FQHC patients had incomes below 200% of the federal poverty level, 70% were racial or ethnic minorities, and 27% were best served in a language other than English. Our health centers served almost 46,000 Medicaid patients and more than 32,000 uninsured patients in 2021. In some rural Nevada communities, FQHCs provide the only access to health care for many miles. FQHCs are uniquely provisioned to provide care to patients left behind by the traditional healthcare delivery system. FQHCs are governed by a board consisting of a majority of patient directors who come from the community being served. They also must offer a sliding fee scale discount and may not turn away a patient due to inability to pay. The health center's work is supported by the 340B prescription drug program, cost-based Medicaid reimbursement, and federal grants to serve uninsured patients. This is the 4th session that the Department of Health and Human Services has proposed an investment in FQHCs in the Grants Management Unit. That 3 governors from different parties have included these proposals in their budget speaks to the bipartisan support that FQHCs have earned in Nevada and across the country. We ask that you continue to value the community health centers by approving and supporting the Health Center Incubator Project in Budget 3195. Thank you.
Thank you very much. Are there any other public comments in Carson City? Okay, seeing no one rushing up to the table, we'll go to Las Vegas, where I see nobody in the room. So BP, do we have anyone on the phone?
Chair, the public line is open and working, but there are no callers at this time.
We do have one in Carson City, so we'll come back to Carson City.
Thank you, Madam Chair and members of the committee. Leah Case on behalf of NVPCA. I just wanted to let you know there will be free lunch in room 3100 starting at 11:30, and I figured that was worth letting you all know and keeping you here for 30 more seconds. Thanks so much.
Thank you. I'll check with BP one more time. Do we have anyone on the phone?
Chair, the public line is still open and working, but there are no callers at this time.
All right, well then we will go ahead and close public comment. I want to thank everyone for joining us today for the first Human Services Subcommittee. It's a start of a lot of conversations that I look forward to having. So thank you very much, and we are adjourned.